if you are immigrant and if you live here in the United States, then you have to know what I did learn, and you have to know what happened to us, to my family, especially to my dad. If you will know this, it might save you from death. You are going to hear something new. I never knew this can happen in America, but now I did learn a lot. I did ask a lot of people, and you know what I see now? I learned that pretty much every other immigrant here in the United States, if he need a doctor's help, if a person need a doctor's help, probably 50% of people, every other person, will be a victim of a malpractice. How doctors are stealing health and how they are selling it, your health, back to you. If you are an immigrant, you're going to hear this in this video. I am an immigrant. Me, my parents, not just me, my parents and 6 kids. We came here to the United States 1998. We came here because we were trying to escape from communists. We came from a part of Russia. It used to be SSSR. When Russia collapsed, a lot of Christian families, they did the same thing. Because we did not like what happened to our parents, our grandparents, and our grandparents. And as a Christian generation, we had a lot of trouble with communists. In this story, I'm going to tell you what happened to my dad here in the United States, but who he is, I'll tell you just a little bit of the story, of a family story. When my dad was a kid, he was best student in a school. And when time came for him to receive a diploma, and he was supposed to get a gold medal because he was the best student in the school. And communists told him, just because you're Christian, forget about your gold medal. If you want to be successful in your life, you have to be non-Christian. You have to be like one of us, like believing in what we believe. Just forget your God and believe in our theory, in Darwin and his monkey, if you want to be like one of us. Otherwise, forget your gold medal, and you're gonna have a low salary job. And they gave him a choice. They said you can be a janitor or welder or a mechanic helper, like washing tractors and changing tires. And my dad said, I want to be a Christian. I want to stay Christian. I don't need your gold medal. And then that's how he finished the school. Then he became a welder. And then after a while, he got married to my mom. and they had 6 kids. I'm the oldest. They had 5 boys and 1 girl. And then Soviet Union collapsed. And my parents, they decided to move on, move away from communists. And then 1998 we came here in the United States, and I remember I was 20 years old, didn't speak English at all, nothing, just a few words. And we started a new life here, learning English. My dad, he went to work after 2 months. After 2 months we came here, he went to work. 1 more month, me and my brother, we went to work. And little brothers and a sister, they were in school. And then 14 years later, everything was good. Everybody in our family were working. We as a Christian, we stayed away from drugs, alcohol, and everything was good. 14 years later, someone decided to lie to my dad to steal his health. And then, when they stole his health from him, doctors decided to sell his stolen calcium back to him. Yes, they did decided to sell his stolen health back to him. They destroyed his calcium, and then they said, you had a bone cancer, now you have to buy your calcium back. Of course they don't say it buy, but they do it in a smart way. They say you have to lay in a hospital for 1 year, and maybe you're gonna die next year, otherwise you're gonna die now. So I wanna try to explain step by step how easy it is to make money out of lie by lying to immigrants. Why they choosing immigrants? You'll get it later after you're gonna hear all this story. I remember when before we came to United States, families who came here before us, they were saying, wow, it's an amazing country, people don't lie, people don't steal, people don't kill. And we thought, something's not usual. Of course we knew things like that happened, but we also knew bad people in America, they go to prison. But now I think a little bit different. Now I know how much people are lying and stealing in this country. And now I think a little bit different. So I want to try to explain step by step how doctors did stole health from my dad, and how he became a real bad. You're going to see this. You're going to learn how a doctor's lie is actually working. You're going to see a doctor's lie in action and in slow motion, because a few things I'm going to repeat so people will get it better, will know better. I know a lot now, and because I know a lot, I think it's dangerous. It's kind of dangerous for me. I know that. But maybe I will escape from such a danger. Maybe. We'll see what's gonna happen. One day, my dad called me and he said that he feels bad because he did throw up at work. And then he came home and he stayed home for a few hours, and then he did throw up again. And he called me and tell me this, and I got a little bit scared also because he said he saw signs of blood, and he got scared also, and he went to emergency with my brother. And people from emergency room, they said, well, you're not the first one. Right now is such a stomach flu, and it happens to many people. And a nurse was very nice to him, and she said, don't worry about it, we will take care of you. And my dad kind of got relaxed, and then somehow doctors kept him hungry for 3 days because they told him they are going to check his stomach inside. And he was there for 3 days and did not throw up anymore, and he felt, actually, I would say, better. And he was asking us for food, and we said no, you have to listen to the doctors and wait. And of course doctors, they didn't tell him he's going to wait 3 days. They told him a few hours later we're gonna check you. And then next day, well, you have to wait a little bit more, and then a little bit more, but it's okay. I don't have a problem with that. And what doctors did, they just put him inside, they put him to sleep, and then they put something inside of his stomach, and then I think they did a little bit video or pictures. And they said, after that, they said, well, I actually don't know what they said, but I know my dad came home, he started eating, he went to work, and he was kind of surprised what happened to him. And doctors, after a while, I think few weeks, doctor scheduled appointments, and many appointments. And my dad went there, and doctors told him, this is not it. You have a serious disease. You need help. My dad said, I feel okay, but what help I need? What help do I need? Doctors told him, you need a surgery. You need a stomach surgery. Why? Because you have a spot in your stomach where you had bleeding before. It looks like it's cancer. It can go all over your body, and you can die. We don't want you to die, and we want to help you. So you need a surgery. And my dad was thinking for a while. He didn't want a surgery, but then he said, okay, I remember we were talking about this in the family, and he said, what, I'm not gonna lose anything, I have a good insurance, I'm just gonna pay a deductible and that's it, and let's see what doctors can do. As they are saying, you need help now because later it might be late. So even though you feel good, you still need a surgery because later it might be late. You need now, as soon as possible. Now I know why they said that, because my dad didn't have enough time to check with the other doctors. But anyway, they did a surgery. And what they did, they cut a part of his stomach, a lot, and his stomach became really small. And then actually my dad, he did recover very fast. Like 3 weeks later he asked doctor if he can go to work. But I remember first few days after a surgery, he was eating very a little, like a small child, like a little child. 3 weeks he feels good, and he was saying, I want to work. Doctor told him, no, you can't go to work at all, but if you really want to go to work, you have to wait, you have to recover. Better. 3 weeks later, 3 weeks more, and then my dad went to work, happy, like usual, strong. He was physically a very strong person. I remember my dad, before all these problems, health problems, at the age, let's say at the age of 55, he was strong enough to grab an apple and just split it like this. And I'm 34 years old, I cannot do it now. He was stronger than me. He recovered fast, he went to work. And of course appointments didn't stop. Doctors were forcing him, you need help, you need more help. We want to help you more. Okay, what do I need? Well, you need something else. We think you have a bacteria in your stomach. You have a bacteria. Now you have to, here's some pills, you're gonna have to eat them all, and these pills are going to help you. You need more help. You need more help. Even though you're saying you're good, it doesn't mean anything to us. You need help. My dad came home after one of these appointments, and he started eating those pills, and doctors told him, you might have a side effects, a little bit of diarrhea, but it's okay. You have to eat them all, and then you're gonna come and see us. They knew what they are doing, but my dad, he didn't know what is that. We didn't know anything, so he started eating those pills. We realized that my dad, he's very often in the toilet, and then he didn't stop. He was eating more of those pills because doctor told him to eat them all, because infection is supposed to be killed. All infection. What type of infection, I don't know. When my dad eat all of those pills, anything he's gonna try to eat or drink, like a minute later he's in the toilet. His diarrhea became really bad. He started losing weight till we went to emergency. And when doctors saw him, they're like, whoa, you're too bad, you're sick, you're losing weight, you're sick, you need help. You have a diarrhea. And then my dad spent 1 week in a hospital. Yes, they did fix him. We were thankful to doctors. They fixed him, but also my dad was totally okay before those pills. My dad, he did recover after a surgery, stomach surgery, very fast. 3 weeks, and he thinks he was thinking he's good enough to go to work. And then 3 more weeks, because doctor told him to wait, he went to work, and he was okay. And those pills that doctors gave him made him sick, made him a diarrhea. Then we realized why doctors give him pills like that, because they want, for 1 more week, they want immigrant to be in a hospital. If such a thing will happen to an American guy, probably that doctor will have a tough life, because everybody will know, and probably that guy will go to take him to court, but not the immigrant. Immigrants like quiet people because they are new in this country. Nothing happened. Doctors fixed my dad, and then we got new bills. Insurance paid a lot of money. We paid a lot of money. And then we realized why doctors were giving out pills like that. They want money. They want business out of torturing immigrants. But this is not it. After a while, doctors call him again, schedule an appointment. You have to see another specialist now. This is not it. Okay, we met the other specialist, and the other specialists were people who give a chemotherapy, and those guys, they said, actually one guy, I don't think he's the one only. I think there's a group of people behind the wall, and only one person comes, and very short questions and very short answers. If something he's not really sure, he goes away and he talks to somebody behind the wall, and then he comes back, and we knew that something is going on. And doctors they are never giving a full answers. They're like, you're gonna have to do this. Why? Well, we'll see, but things like that. So that guy, I think they're called oncology doctors. He said, you need a chemotherapy. Why? Because yeah, you're healthy now, but something may happen later. You can be sick. You can become sick, and then we will not be able to help you, because your disease may grow up, and you need help now. Even though you're saying you're healthy now, but doesn't mean anything. We want to help you. You need help, and. They were saying this many times till my dad say, okay, if I need a chemotherapy, okay, I'll go through a chemotherapy. Because doctors, he was explaining this like, well, even though if you're healthy, but if you're gonna go through chemotherapy, it's like a just in case. Just in case your disease will not come back. You have to go through this. It's better for you. We want to help you. Even though you're healthy now, just in case you have to go through chemotherapy. And finally, my dad said, okay, do what you want to do. I will listen to you. And then I would say all of our biggest health problems start coming to us when my dad started going through chemotherapy. Before chemotherapy, my dad was working, happy, healthy, and I remember doctors put him something like a rubber piece under the skin right here. That's where the needle goes in for the chemo. And my dad started receiving chemo, and I didn't see him for a week, and about a week later I stopped by their house, and he was at the front yard working something, and I came to him. At that time he received the chemo twice a week. So I didn't see him a week, so twice he did receive a chemo right here. I came to him, I said hi. At that moment, I realized that my dad, he looks different. Especially his eyes. I just look at his eyes and I saw something is not right. His eyes looked like he is a 70, 75 years old person. At that moment he was 56 years old. His eyes looked like he's 20 years older than I saw him previous week. And I kinda got scared and I was thinking, how should I ask him how he feels? And then I just said, Dad, how you're doing? How you feel after chemotherapy? I got surprised. You know what? He looked down for a while, for a few seconds, and I felt like I am his dad and he is my child, which just did something wrong, and I am going to punish him. That's how it looked like. I was not mad. I just asked how you feel, and he looks down like he did something completely wrong or stupid. And then he just slowly looked at me and he said this, I wanna puke. I hate chemotherapy. And I was scared to tell him anything. I just like, okay, that's your business. I don't want to tell you anything. That was first week. Second week, 2 more chemotherapy. In 1 more week, 2 more chemotherapy. And my dad started losing weight. His eyes look old. A lot older than he was before chemotherapy. And you know what doctor told him? He said, oh, you're very strong. He just touched his muscles. He said, wow, strong man. He kind of laughed and I kind of gave him a hug like, yeah, you're very strong. You need more chemotherapy. My dad said, why do I need more chemotherapy? I don't like even the beginning, I don't like it. And doctor said, no, you need more help. You need more chemotherapy. See, your hair is still, you still have your hair. People who go to chemotherapy, they lose their hair. And sometimes they cannot walk. But you're walking, you're going to work, you still have hair. That means you're strong. I need to double the chemotherapy. And my dad got confused. He said, what is your goal? And doctor said, my goal is to see you in a bed, in a hospital. You have to lay in a hospital. My dad got confused. He just went home and he said, I think over the phone he said that he don't want any more chemotherapy because he was totally okay before chemotherapy. And doctor, he got surprised. He said, you have to listen to me. Otherwise you're gonna die. You have to stay with us and lay in a hospital. It's gonna be better for you. My dad said, I wanna work. Why do I supposed to be in a hospital? I'll just stop receiving chemo and I will recover. And my dad was right. He stopped using chemo, he started doing better, he continued to work. With this rubber piece right here, under the skin. And then doctor kept calling him and you need help, you need appointments. And My dad went to one of those scheduled appointments. Sometimes he was skipping them because he realized that doctors they're acting like mafia, not like real doctors. And when next time he saw a doctor who destroyed him with a chemo, he said to him, "I don't want chemo anymore." And doctor, they are smart. They know how to lie. They know what to tell a person. And they create another lie. They said this. They said, "Okay, if you don't want chemotherapy, it's okay. Now we're gonna give you, instead of more chemotherapy, we're gonna give you shots." I believe it was 17 shots. And he said this: "Chemotherapy remove from your bones a calcium, make it soft, remove a calcium from your bones. Now we're gonna give you shots, and those shots, they will add calcium to your bones." And my dad got kind of confused. He said this at home. We were thinking, we said, what's the reason of removing calcium and then putting it back? And we thought, we knew this is some type of business. This is not, has nothing to do with health help, nothing. Because my dad was totally fine before chemotherapy. He recovered from surgery very fast. That means he had a good blood, and because he was working like always, that means he was healthy. That means at that time he didn't have any cancer. Cancer came later. And you're going to see all these steps, how cancer is coming, how doctors are inviting cancer to a human body. I'll tell you a different story later. You'll see how people with the same type of disease, which don't go to chemotherapy, and they are alive now. I know those people, but I'll tell you that later. Now come back to our story. Because doctor said, "I am going to give you shots, they are going to help you, I'm going to give your calcium back, and you'll be okay." And we were like relaxed, we were happy, like, oh, okay. Now doctor will give a new calcium back, and my dad will be happy again, and his eyes is gonna become normal. At that moment, my dad, his eyes looked a little bit older right after the chemotherapy, and then he recovered. And then shots, those 17 shots. And finally my dad said, "Okay, I'll take those shots." And just before the shot, doctor told him, "You are going to like this. You're going to be thankful to me. I'm going to help you. You will like it. You're going to be happy. You'll see it. You just trust me. You have to trust me." And when my dad received one shot, not 17, just one, he went to work. Right after appointment, he went to work. And 4 hours later, he got paralyzed. He started shaking. He started shaking very fast, like he's cold. And he called my brother, and they were planning to call 911. But then my brother said, "Let's save a little bit money. We're gonna go straight to emergency." And he went with my dad to emergency room. And people from emergency room, they saw him shaking. And he said, "What happened?" And my dad said, "I received a shot." "Oh, okay, which shot? What is the name of the shot?" They act like they don't know anything. Same hospital, they have computers, they can check what type of shot my dad received. But they don't want to do that. They are asking, "Do you know what shot you got? Do you know the name of it?" My dad said, no, I don't know the name of it, but I know doctors told me he's giving me a calcium back to my bones. A calcium which he stole before with the chemotherapy. Now he's giving a new calcium. And they got a little bit confused. They called him, he's not answering. We called him, he's not answering. 5 hours, he's gone. Nobody knows where he is. And my dad is shaking. Shaking like he's cold. In the emergency room. 5 hours. Finally, 5 hours later, somebody show up. Not doctor, who said we're going to help you and you're gonna be thankful to me. Not him. Like a nurses. Some of the nurse came and said, oh, don't worry about it. This is a side effect. You just can go home and relax, but if you want, you can stay in a hospital and receive the other 16 shots. My dad got confused. What is this? I don't want those shots. I feel okay before taking them. Well, go home. And he went home. 2 more days. He did recover. He stayed 1 more day and then he went to work. He recovered that stupid shot. He did recover that. He went to work. And then, because my dad was strong physically, he started recovering. He started recovering, he started working, and he said, I don't want more of those shots. And of course he had an appointments, and he just started skipping them because he said, I don't see any help from this. They were telling one thing and doing different. And since then, my dad said, if doctor will offer me anything, I will say no, because he did lie to me. And my dad, he did what he said. After that, many appointments my dad had, and anything doctor offered him, he didn't believe him. He just said no. So listen what happened next. So he took one of those 17 shots. Nothing more. He recovered in 3 days at home. He went to work. And then he refused all the rest shots. And he started feeling better and better. And one day he decided to go to call the doctor, schedule an appointment, and he was planning to tell them to remove the port right here, the rubber piece under the skin. He just said, I don't like it in here. I'm fully healthy now. I did recover from the shot that made me shaky, and I'm good now, and I'll just go and remove the port. And I remember we were talking in the family about this, and I said to my dad, Dad, I don't think you should you should remove that port right here. I don't think you should remove it, because doctors, you're coming back to them and they don't like you escape from their hands, and they may punish you for this. You have to listen for them. Everything they say, even if they're lying to you, you have to listen to them or stay away from them. Just don't go, because you never know what they're gonna do in here. He looked at me and he said, you're a little bit not right. I said, Dad, don't go at all. Or if you're gonna go, just listen to everything they say, because you're an immigrant. And you know, my dad got kinda a little bit mad, and he said this, where you're getting this type of information? And I said, Dad, listen to our stories of people telling, listen to the other immigrants what happened. If an immigrant will go to doctors, he never recovered. He stayed sick, usually. I know only a few people, immigrants, who did recover after help. Usually they recover only in a case if they escape from doctors. People who go to a doctor's often, they're always sick because they're immigrants. And listen what happened next. When my dad went to the doctor's, scheduled an appointment, and he went to the guy who installed the port right here, and he said, I want you to remove this port from me. And doctor who installed the port, he got really surprised, and he said, your doctor did not tell me to remove that. You are telling me to remove it. And my dad said, he's not doing what he told me to do. He just, I don't like this chemo. Just move the port out, and I'm okay now. I'm going to work, and I did recover from a chemotherapy already. You know what happened? A guy disappeared somewhere. He said he's gonna come back, and he disappeared for a while. I'm not sure how long time it was, but I remember my dad told me, I cannot ask him now, he's on cemetery right now. I remember my dad told me for a while, like I don't know, he got tired of waiting him, let's say 40 minutes, let's say, I don't know, an hour maybe. The guy came and he said, okay, we are going to remove your port, since you don't like chemotherapy, you don't like our help, you don't like us, okay. Since you're saying you're good, and now we'll see how you're gonna be good. Of course, he did not say this with the words, but he meant that. He was keeping this in here because I know what happened next. And that was the moment which hit us the most. And I call this a magic port removal. A magic. Because they did something magic. Listen what happened. My dad completely recovered. Good. At the moment he was removing the port, they didn't put him to sleep, nothing. They just put the shot right here and they removed it, and they, you know, they put the skin back. And I don't know what they did, but he came home. My dad came home, and he looked not happy. I didn't see any big difference. Just he looks not happy, and he don't talk a lot. He's like a quiet person. He's a little bit, he's different now. At that moment he was different. My dad, he likes to talk, and he was a happy person. At that moment, when he came after the port removal, or magic port removal, he was not talking a lot. He was not happy anymore. And then I remember, because I told him doctors may punish you for this, and he was thinking about that too. And I was planning to ask him in the details, but I didn't want to make my dad mad, and I was trying to be nice, and I just said, do you saw anything unusual while a port removal or something? And he said, nothing. Well, they just put a shot right here, and then cut the skin and remove the rubber piece, and actually he did something unusual. I said, what? He said, you know, the shot that my dad got before the removal, doctors told him they are going to give just a half of it, half a shot. I don't see any unusual here. At that point, I didn't see anything. When they removed the port, and then doctor said that he's going to give the other half of a shot. At that moment, I still did not get anything. 4 days later, my dad, he looked really, really, really tired. I never seen my dad to be like that. My dad used to work 8 and 10 hours a day, strong physically, stronger than me. I never seen him tired like that. He's gonna like walking a little bit in a garage doing something, and he sits for 5-10 minutes, and then something else, and then he sit again. And then I start thinking about that shot he got when the doctor said they're going to give him a half a shot and then the other half. And then I was thinking, what if the other half is not the same shot like the first half, like a magic thing, really magic. 4 days later, my dad, his skin and face like white. He's really tired. I never seen him like that. He started coughing, and then we went to doctors, and then a week later, my dad is really, really bad, and we went to a doctors, and they gave him a blood, like they were feeding him. And my dad, he realized that he feels better. And doctor came and he said, "See, how you feel now?" My dad said, "I feel better." He said, "See, you have a bad blood now. You have a bad blood now. I just gave you a good blood. You feel better. And after 2, 3, 4 hours, you're gonna feel bad again because you'll need blood again." And my dad said, "What happened to my blood?" And doctors, of course, they didn't like to explain a lot, but because my dad is smart, he got it right away. He said, "You know, your blood is bad because calcium in your bones, blah blah blah. They make something, and you have a lot of white cells in your blood, a lot more than they're supposed to be. And your red cells are poor, and you have bad blood." And my dad said, "I had a good blood before chemotherapy." No, you need more help. You need more chemotherapy. My dad said, "No, I don't like chemotherapy." And then doctor disappeared, and then he come back and said, "Okay, we will not give you a chemotherapy, we will give you a medicine. A medicine. A same type of, I call it urine. The same type of urine, they call it medicine. Before they said it's a chemotherapy, now they're saying it's a medicine. A same type of thing, a same type of urine. They call it differently now, a medicine." And then what? And doctor said, "Well, and then you're gonna feel worse, and then we never know, maybe you're gonna die or what, but we don't know what's gonna happen. If we're gonna give you a new medicine now, well, we have 100 different types of chemo, 100 different types. We have to choose which one is gonna work for you." And my dad realized that if they have 100 different types of chemotherapy, they probably are going to try 99 those chemos which are not going to help you. If they have 100, then they'll try 99, one of those which don't help. And we got confused. We just didn't know what to think. And at that moment, doctor, he realized that my dad is like refusing everything this doctor say because of the previous lie. And doctors realized this. And he said, "Probably you don't like me. You know what? If you want to go, we cannot help you anymore. We cannot help you anymore." Remember, till this point, they was always saying, "You need help. We're going to help you. We are helping you." At that moment, doctor said different thing. "We cannot help you." you know, your insurance will cover a second opinion, you can go somebody else. I will recommend visit this guy. This guy helped a lot of people. He gave a name, he gave the address, and he said, this guy, this doctor, he's specializing on helping people who recovered from, who are recovering from the stomach surgery. And my dad said, I did fully recovered from the stomach surgery. I need to recover from chemotherapy you gave me. No, you need more help. Whatever, we cannot help you anymore. Go to that guy. And we went to different guy, different city, hoping maybe this guy is not lying that much. Maybe he's better. And we came there, and the guy came, doctor, and interpreter came. Even though my dad, he didn't need an interpreter, he did speak English, and I was there. I speak English. My sister is speaking much better English than me. But anyway, he came with an interpreter, and I know why. I know why, because if I'm gonna say something to a doctor, I mean to my dad, later doctor will hear interpreter. We cannot talk in secret, but it's okay. We had no secrets. We just came and we said, here's my dad, do you know how to help him? He was total okay. Before the surgery, he recovered. After the surgery, very fast. In one shot, removed his calcium. Do you know how to give him his calcium back? And he looked scared. At that moment, I didn't know why he looked like he worried a lot. A doctor worried a lot. And then I realized why. Because his mission was to tell my dad a very, very bad news. That was his mission. Every doctor in a big hospital, they have every own mission. They serve one big machine. And I call that machine a big liar. And all those little doctors, they are serving a big liar, big master, a machine which makes money out of people suffering. How they did make money, you're going to hear at the end of the story. And that guy, let's call him a doctor number 2, he said, no, we cannot help you. You're very sick now. See, you're sick now. We cannot help you. You have to go back to doctor number 1. Remember, the guy who sent you here. Well, only what we can do, if you're gonna lay in a hospital for 1 year, we're gonna give you a different chemo, and we're gonna extend your life for 1 year, and then you're gonna die next year. If you're gonna refuse our help, then you're gonna die now. So, you know what that means to me, to us? It means they're saying, come on, buy your health back. They don't say this with words, but when they say lay for 1 year, and you're gonna die next year, 2014, you're gonna die 2014. Why you wanna die now at 2013? Why you wanna die now? Just buy 1 year life and that's it. How an immigrant will buy 1 year life? My dad, he was not rich. He just had, let's say, 35% of equity of his house. That's it, what he had. But doctors, they know what they're doing. They're saying this. It's okay if you don't have insurance or if you don't have equity in your house. Don't worry about it. We have a program just for you. We want to help you. You have to listen to us, lay in a hospital for 1 year, and American taxpayers will pay it for you. Don't worry. You're not American, you're an immigrant. You have to lay in a hospital, and American taxpayers will pay it for you. And my dad said, I know what the chemotherapy is like. I hate chemotherapy. I wish to die now. I don't want any more chemotherapy. It's better to die now than to be tortured for one more year. And I realized the doctor is like kind of confused, kind of scary. And I just said to my dad, let's go home. I just don't want to be here. At that moment I felt like something is stinky right here in the room, in the corner. I didn't smell it with my nose, but I smell it somehow. I felt like I am in the front of some type of authority which sell life, and now I need to beg them, or my dad need to beg them 1 year extension. They cannot give it your calcium back. They only can sell it back, your calcium. And my dad, he realized that, and he said, I'll die now. We went home. We gathered together. We did pray. My dad, at that moment, he had 9 grandkids. After he died, 1 more grandkid born. Now he had 10 grandkids, but he's on cemetery. And we all gathered together. We did pray. He said bye to us. He started losing weight very fast. He, after a magic port removal, right here, after a magic port removal, a month later, my dad looked not 56 years old. He looked 10 years older. 1 more month, he looked 80 years old. And when he did look 85, 90 years old, very, very, very skinny, no muscles at all. He used to have a big muscle, very strong guy. He was shorter than me, but very strong hands. Right here, his hand right here is like twice wider than mine. He was a really strong person. He at that moment, almost 3 months after the magic port removal, he looked like 95 years old, very, very tired eyes. If you want to stand up, he have to grab something. And we were helping him to go to a bathroom. He couldn't walk. Last week, he was not eating at all. He was staying home. He said, doctors are not helping me. They were saying they are helping, but they are torturing me for the money. They were planning me to put me in a 1 year laying in a hospital, and while I will be laying in a hospital, they will suck money from American taxpayers, and then I will die. Do you see how a lie works? A system which doctors create. They give people chemotherapy, not just to my dad. They did it to many people. Even though they say this, when they were offering a chemotherapy to my dad, they were saying, you're not the first one. We did help a lot of people like you, and we're going to help you also. And now we know what help they are offering. They just steal, destroy a calcium, and then calcium became, a bone became yellow. Bone supposed to be white. But my dad's bone became yellow. How I know this? Because his teeth became yellow. Before the magic pore removal, his teeth was like normal color, like always. But after that, after he started losing weight and his blood became bad, his teeth became yellow like he's 100 years old. person. Do you know what this means? This means not just his teeth, all his bones are yellow. That's why his blood became bad. That's why his muscle disappeared. And at the moment he died, he was like really skinny person, like no shoulders, nothing. He's like small person. It's like he lost his muscles and everything. At the moment he died, just a bone and skin, that's it. And doctor said, yeah, see, he got bone cancer. He died from bone cancer. You know what he died from? He died from a doctor's lie. Because doctors make his bone yellow. How they do it? With the chemotherapy. And while they're giving calcium back, at the moment while the doctors are selling a stolen health back, and then maybe bones will become white again and blood will be a little bit better, and that way a person will live a little bit longer. And then what the doctors will say, they will say, see, we help your dad 2 more years to live, or 1 year more. Now you have to pay for 1 year life. That's how they make business. 100 years ago, 200 years ago, 300 years ago, people were stealing different way. They were just coming in a house, beat people physically, steal their money or gold or anything like that. But nowadays, they don't come to your house. You go to them with an ambulance. You go to them, and a little problem, they make it big. They destroy a calcium, and then bones became bad, and then person is shrinking, and then they start giving calcium back little bit by little. Depends how long they want to keep an immigrant in a hospital. And then if the immigrant does not have money, it's okay. If the immigrant has only a 10% equity in his house, it's okay. American taxpayers will pay. Because why they choose immigrants? Because immigrants will not tell anybody what happened to them. I am probably the first immigrant who is going to speak about the public, going to speak about this to the public, about doctors' malpractice, about doctors' lie, how they're lying and making money. That's why all this video is about. I'm going to record this, and I don't know how many people will listen to this. And now you're going to listen something that you never heard before. My dad's disease started from a same disease that the other guy had. I want to tell you the other story, a very short story, so you can compare these stories, and you will see this gonna be a proof to you, and you will know who is a source of cancer, who make cancer, and how they do it. A guy in Ukraine, where I used to live, same street, my neighbor, he was really skinny person all his life, and when he was 40 years old, but before he was always had a problem with his stomach once in a while, and one day he did throw up blood, exactly same like it happened to my dad. He went to hospital, they did a surgery to his stomach, and they did a same surgery like my dad had here in the United States. They just remove a part of his stomach, and I forgot how it's called in English, but where the liver is, there's like a little green bag. I don't know how you guys call it in English. So they removed that piece also, that thing. That guy, he was 40 years old when this happened to him. Now he's 60 years old and he's alive. He didn't go to chemotherapy. He's alive now. My dad, same type of disease. He did throw up blood. He got a surgery, stomach surgery, and doctors removed that little green small bag where the liver is. Exactly same thing. My dad is on cemetery, the other guy is alive. Do you see a difference between Ukrainian or Russian doctors and American? They are all liars. But now I'm trying to explain to the people who lies more, who lies less. If you're an immigrant, if you're living here in the United States, then someday, maybe, a doctor will lie to you also. And you're going to lose your calcium. You know what's going to happen after a calcium? A water can go under the lungs, or some people, they get their legs get big, swelling because the water goes in there. Sometimes the hands, or one of the leg or one of the hand, and then die. And you know what doctors will say? They'll say cancer. Cancer spread to all of your body, to all of your body. How is the cancer spreading for all of the body? Let me explain you. A chemotherapy which goes to the port, goes to your blood, or the other way, a big pills, which doctors will give it to you with gloves, big pills, and a mask. All those pills, they do the same thing. They destroy calcium. Or shots, like 17 shots that doctors offered to my dad. He got only one. But some people, they receive more in the muscles. 3 ways of stealing health. Chemotherapy through the port, shots, which goes to muscles, or a big pills. 3 ways of stealing health. And then what's gonna happen? Blood became bad, it became leukemia, and then bone cancer. My dad, with the big muscles, big natural muscles, you know what that means? He didn't have a leukemia. How I know this? Because he had big muscles, and the doctor he was touching his muscle. He was laughing at him because he knew these muscles, after the chemotherapy, they will be gone. Do you know where my dad's muscles went? Last month of his life, he was eating like a kid, but when he go to a toilet, the toilet was full. That's where his muscle went. He was started losing weight. And then he became just a bone and skin. They dry up my father's bone. They make his bone dry for the money. Because they were expecting people will say, hey, please help me, I want to live 1 more year and lay in a hospital for 1 year and then die next year. And then for 1 year, how much money they're gonna make? $1,500 per day. $1,500 per day. If a person will lay in a hospital for 1 year, how much money is that? That's why they give a chemotherapy. They like money. They torture immigrants. They choose immigrants. Not just immigrants. They do the same thing to Americans also. Now I want to tell you a very short story. Very short story. You will compare, actually 2 stories. You will compare them, and then you will see a difference. And then you will get it what I got now. If you're gonna see these stories, you will see who is behind the cancer and who makes cancer. One more story. 2 people. 1 person in America, the other person is in Ukraine. Let me tell you what happened in Ukraine. A guy, He's my grandpa. 71 years old, he got the prostate cancer. Doctors did a surgery, and what they did else, I don't know, they cleaned his whatever. They did a prostate cancer surgery, prostate surgery. And that guy, he went home, no chemotherapy. He lived 9 more years, and he died 2 months ago when he was 80 years old. That's one story. Now the other story. A guy in here, in America, same problem, a prostate cancer. Just the beginning. You know, a prostate cancer, actually it's easy to fix, but doctors, they don't want to teach him how to fix this thing. They just say, you need a surgery, because surgery is more money. So what they did a surgery for this guy in America. Not 71 years old, 59. 59 years old, right here in America. I know this guy, I know this family. After a surgery, the guy started recovering. Same like my dad, started recovering after the surgery, after a stomach surgery. But this guy, he had a prostate cancer. After a prostate surgery, he started recovering. You know what doctors did? They gave him pills like that. They remove his calcium from the bones. Why? Because they know what's going to happen next. When they remove a calcium from the bones, then the blood became bad, then the person started losing weight and become older and older and older, and when he became really old, the water goes to his legs, and his leg became really big, and he looked 80 years old, and he died when he looked 80 years old, but in reality he was 61. So when the doctors did surgery, he was 59, and then he recovered from surgery and a little bit chemo and 1 year extension, and he died when he was 61 years old, and they had to pay a lot of money for 1 year extension. Not just them, not just their family. American taxpayers are paying for 1 year life extension. But in reality, if the doctor will not give chemotherapy, this guy, maybe he will die when he's going to be 80 years old, same like my grandpa. My grandpa, he got a surgery 71, and he died when he was 80. No chemo in Ukraine, no chemo. In America it's different. America likes money, and they choose immigrants for torturing, give them chemo, and then 1 year extension or 2 year extension. They don't care if the guy will die. They know for 1 year extension or 2, they will get everything this guy had. If it's gonna be not enough, then American taxpayers will pay it. They don't worry. They will get their money. I know what I did learn now. I am thinking a cancer starts always always starts from a lie. Okay, let's say pretty much always. Because there is no, I don't think there is a disease in a like, let's say, a natural disease, in a mother nature, a disease when a person will, let's say, 50 years old and he's dying from cancer, and before he let's say last week of his life he looks 80 years old. Ask old people. If you, maybe in America it's like this, but if you're gonna ask older people in different like countries, ask them if they remember a disease like that. When a person is 50 years old and he's dying from cancer, let's say he's dying, they don't know what the cancer is. Let's say he's dying and he look 80 years old. You know what that means? If a person looks a lot older, that means his disease is not from Mother Nature. His disease is from hands of doctors, of helpers. That's a man-made disease. business. A guy, I know him, I knew him, he's on cemetery now. When he died, he had one kid and he was 20, I'm not sure, 24 or 26 years old. Immigrant. I was not at the funeral ceremony. I was not there, but people who were there, I heard that the guy, he looked like he's like dried up older person. He died from cancer. A disease cannot make a 24-year-old look 84-year-old. Disease cannot make that. Only a doctor who destroy a calcium, who steal health, who destroy a calcium from the bones, that's what makes people look a lot older. That means it's a man-made disease. That's why a lot of people are dying right now. And I have an idea what we as a people can do to stop such a lie. I have some ideas, but who is going to listen to me? I am an immigrant. Who's going to listen to me? I know my idea will work, and I'm sure twice less people will die 20, 30 years sooner. Twice less people will die from cancer at the age of 50 or 60. My dad passed away at the 56 years old. Before chemotherapy, he was stronger than me physically. How his blood became bad. He recovered from a stomach surgery in 3 weeks. His blood was very good. His blood became bad after a magic port removal. They know how to punish immigrants those immigrants who are not willing to lay in a hospital for 1 year. They're just not willing to redo their paperwork. They just like kill them and that's it. And I think a magic port removal did everything. And now I have a new name for chemotherapy. I usually don't say chemotherapy. I say a satanic urine. That's not the chemotherapy. That's not the medicine. That's a plan for the evil people who wants your equity, who wants to destroy you, who wants to steal everything you have. They are saying they are helping you. They are saying they are giving you medicine. But in reality, they are giving you a satanic urine to destroy your bones. And bones became yellow because teeth became yellow. And then blood became bad. And a person is like drying up. And that's why a person is looking older. 1 more month after chemotherapy, person will look 10 years older. 1 more month, more 10 years older. And when a person will look 80, 85, he'll die. Business, killing people, torturing them here in America, and choosing immigrants for such a business. It's a good money, very good. If you are an immigrant here in the United States, or if you're a Christian, or let's say if you're a rich American, if you have well, maybe not too rich, let's say you have a 50% equity in your house, or your house is paid off. You know what that means? That means someday, if you're gonna have a little problem, health problem, doctors, they can destroy your calcium, same as they did to my dad. They can steal your health, and they do it for the plan, for the purpose. Purpose is your money if you're a rich American. If you're an immigrant, then they also like you because you're not gonna tell anybody because you speak bad English. You're gonna be laying in a hospital for 1 year. Or if you're Christian people usually they don't go to court because of the, I would say, stupid church teaching. I'm a Christian also, but I have a little bit different mentality. And I think a evil is supposed to be punished. Doesn't matter you're a Christian or non-Christian. Evil is supposed to be punished. Okay. What you would do if you will ever see somebody is beating up one of your parents, just physically, just beating up, what are you gonna feel? I know you don't want to hear this question. I know this because it feels terrible. You know what? I want to tell you this. I felt the same thing when I was standing by my dad and a doctor were giving him a chemo. And I did not tell this to doctor what you are doing and why, because I knew he may get mad and may kill my dad. And I kept myself quiet, and I knew he's doing something not right. And I felt same way, like if somebody will beat up my dad physically or torturing him with the chemo, it's the same feeling, exactly same. And if somebody will beat physically, let's say another person, this is a crime. That person can go to prison. Yeah, I know, this is a crime. But when a doctor is torturing person with a chemo, no, this is not a crime. This is called help. It's called life extension, 1 year life extension, and then those guys will wipe out all your equity. You know what happened after a funeral? We receive bills for help. My dad had a good insurance, and after he stopped working, he had a medical coupon, and doctor get money from that also. And then they decided this is not enough. They put a lien to my mom's house. Now my mom supposed to pay them for help. They helped my dad to die, and now my mom's supposed to pay them. Only in America. I hate that. I remember doctor said to my dad, "Why you are refusing our help? You're refusing a chemotherapy, you're refusing our help." My dad said, "I'm not refusing help, I'm refusing a torturing. I was totally okay before chemotherapy." And doctor said, "Why? Looks like you wanna die now. We're helping you. We wanna help you. We wanna extend your life a little bit. We wanna help you die next year. Why you wanna die now? We're helping you to die next year, but looks like you're choosing to die now." And I remember doctor number 2. He was when I asked him how many people die in a situation like this, how many people are dying, he said, "You know what? 70% of the people with a disease like that, they die, and 30 will survive." And I say, then what's the point of chemotherapy if the more than half are dying? then why you guys do a chemotherapy? He got a little bit, he didn't like my question, and he said this. He said that's their choice. That's the choice of the patients who are not willing to go through all chemotherapy. And now listen what I'm thinking. Why are people are choosing to die instead of laying in a hospital for 1 more year? Because they feel what it's like to be a victim of a lie, of a doctor's lie. That's the first thing. And the second thing, they feel better. They choose to die because they say it's better to die than to experience what the calcium exchange is, a calcium removal is. And my dad said this also. He said it's better to die than to be tortured 1 more year with the chemotherapy. You know what? Now, do you see what I mean? Chemotherapy is worse than death. So if I will kill somebody, it's death. I have to be punished for that. What can be worse than death? Doctors think there's nothing worse than death. That's what they think. But the patient, they think differently. They say death is better than chemotherapy. So do you see how things works? Death is deserve punishment for people who kill other people. But chemotherapy, no. Chemotherapy is help. How come chemotherapy is help? Chemotherapy is a lie. Chemotherapy is not help. So doctors, when they're saying they're helping you, they are lying. Their main goal, your equity. If you don't have equity, then you're immigrant. Then you're gonna lay 1 year in a hospital and they suck money. They will suck money from the taxpayers. Business. Chemotherapy is business. That's why a lot of people are dying from cancer. They are not dying from cancer. They are dying from torturing. They are dying from a doctor's lie, because a cancer starts from a lie. To me, cancer and a lie is kind of same thing, because cancer starts from a lie. A lie became cancer later. So lie and a cancer is a kind of same thing. And a chemotherapy is not medicine. Chemotherapy is a satanic urine, because it brings death much sooner. It kills you. And doctors know this, because after they give you a chemo, they know exactly how long a person will live. They say, you know, you have 2 months, maybe 3, maximum you have a half a year. They know exactly how long it takes a chemo to kill person. But the person don't want to die, and person start asking for help, and they extend a little bit his life, and a person will die next year or a year after, and for 2-year extension they will wipe all their equity. Now my mom is supposed to pay $16,000 lien from a house, equity from a house. If my mom will sell a house now, if my mom will sell a house, let's say 5 or 10 years from now, then she will not have to pay 16. She will have to pay a lot more. So do you see a reason? Money. Money. That means money. Money is a reason for cancer. Why? That's why people are dying. I remember after a funeral, I came to my mom's house the same day in the evening. I was holding my 2-year child, and as soon I came to the house, and he's like pointing down, and he said, he was pointing down something. He didn't speak. He just few words. He just know a few words, and he was pointing it down, and I put him down. As soon as his feet touched the ground, he started running very fast, and he went to a hallway, and he went to my dad's room, and he stopped and I realized that something is not usual. I just come after him, and he stopped where the door is, in a door jam. He stopped, and he just like freeze. At that moment, I was coming, and he turned towards me, and then he was pointing to my father's bed. He was pointing like this, and he said in his language. I don't know what that means, but and he said just one word, Ukrainian word. He said "Nima." You know what that means? That means gone or no more. And now I'm start thinking why this 2-year-old child did this. Because he was with me at the funeral home, and he saw my dad there, dead body. And when we came to his house, to my dad's house, he just decided to check it out, because my dad, when he was too bad, he used to play with him. He was laying, and when this guy comes to him, he just gives him his hand, and he start playing with his hand, and he started laughing. Even though my dad was very bad, he likes to play with him. And you know what I thought at that moment? I thought someday this guy will grow up, and I will try to explain to him who stole his grandpa from him, why, and how much money they make when they do this. Such a business. Torturing people, and when they die they just say cancer. That's it. Yes, it's cancer, but it's a man-made cancer. It's designed by Satan and his people who wear white, nice white dress, and they act like angels, but they are satanic servants. They kill people. They choose mostly immigrants for that. Business. Very nice business. Okay, very short story. What happened to the other immigrants? I know this guy. He's related to me. 70-something years old. He was 74, I think, when he needed the first time in his life doctor's help here in America. And when he went to a doctor, and they checked him and they put him to sleep, and they said he needed surgery. They put him to sleep, and they cut his belly like half, like this way and this way. They cut just the skin and put the stitches back. And when he wakes up, they gave him pills, and he went home, pain relief pills. And this guy realized after a few days the doctors did not do anything. He went to a different doctor, and when different doctor checked him, he said, "You had no surgery. Your skin just cut." Why? Because doctors, they suck, I think, $70,000 for a surgery, but they did not do anything. They just cut the skin. And then the other doctor did the surgery again, fixed him up, fixed him inside, and he's okay now. I think he's 8 years old now, and he's okay now. But the first surgery, it was just for the money. They just cut the skin and sucked the money from the taxpayers, because this guy, he didn't have insurance. He had for the older people, he had a medical coupon or something like that. So who's paying for this? For American doctors American doctor who lie. Who's paying for this? American taxpayers. American working class people are paying for a doctor's lie. Only in America. You're not gonna find this in a world somewhere else. Only in America. A lie is very good. Works very good. You know why? Because American government allow doctors to have a special insurance which will cover their malpractice. And they're paying for this, doctors are paying for this, and then what they do, they want to use it. Because they pay for that, they want to use it. That's why they continue to lie. They choose immigrants because they're like quiet people. And this guy, he didn't go anywhere. He didn't go to a lawyer, nobody. He's like, whatever. That's how things work in America. I forgot to say one very important thing. I know of 4 people. They live here in the United States and they are immigrants. 4 people who had exactly same disease like my dad. I think it's stomach flu or stomach infection or what is it, I don't know. But what happened to them, they throw up blood, same way like my dad did. And because they were scared to go to American doctors because they know they are immigrants, they might become a victim of a malpractice. And because they speak bad English, they just refuse to go to doctors. And all those 4 persons, they are alive now. I know them by name. I talked to every one of those persons. 4 people, same disease, they are alive. They didn't go to doctor. My dad, he went to doctor's help, now he's on cemetery. Do you see a difference? How Mother Nature will take care of your health problem and how American liar will take care of your health problem. If you're a doctor and if you got mad because I said liar, please don't get mad, because in Russian language, a liar and a doctor, it sounds the same. I can call a doctor vrach in Russian language, vrach. And a person who lie a lot, who lie 24/7 also, I can call him vrach. Vrach based on the other word, like vrachevstvo. Vrachevstvo means a magic mixed with a lie. So a vrach, you can call doctor vrach. And you can call a person who lie a lot also vrach. So if you're a doctor and I call you a liar, in Russian language it sounds the same. So don't get mad if you're a doctor. That means you're a liar, because you're a doctor. Actually, my dad, he was planning to be a doctor. When he was a kid, he was planning to be a doctor. But because communists told him, you're a Christian, you can be only a janitor or taking care of a farm worker or welder or things like that. And my dad became a welder. And when we came here to the United States, he chose the same type of work, mechanic, welder, and he was the best, I think. A lot of people who worked with him, they liked him a lot because his ideas, they were like brilliant. He was a very smart guy. But doctors, they don't care. Smart, how many kids you have, grandkids, they don't care. They just want your equity, want business. Business. Killing people is a very good business in America. I forgot to say something very important, I think. Remember I told you about those 17 shots and my daddy got just one. And after he got just one shot and he started shaking, I came home and I searched online what kind of symptoms is this, and I Googled it in Russian language and in Russian specialists and what they are saying, and I found the answer. I found actually 2 answers. One answer is a patient has a problem with kidney problem, and the other answer is a side effect from chemotherapy. And a side effect from chemotherapy, a doctor explained this as when a calcium is destroyed, when calcium shortage of calcium, something like that. So one shot which make my dad shaky, that was shot not like doctor explained he's going to give calcium back. That was a lie. He did the opposite thing. He removed the calcium, but he was saying he give it back a calcium. And that was a lie, and that lie affects all the other decisions that my dad made after that lie. And now my dad is on cemetery. I cannot believe it. I cannot believe it. Such a strong, physically strong person. Never been sick before. Just a stomach flu. A stomach flu become a deadly somehow with a doctor's help. And I just remind something. Same doctor who did a surgery for a person related to me that I told you before, just cut the skin. Same doctor, he helped another immigrant, a lady. She was about 60 years old. And you know what they did? They did a surgery, and then somehow they forgot some type of tools, like I don't know, scissors or what, I don't know. Some type of medical tool inside of the belly. Do you think they forgot that? I think when they forget some type of tool, doctors, during a surgery, I don't think they forget that. But the tool is kind of not big deal. If you're gonna do an ultrasound and go to a different doctor, you can kind of prove it what you have. But the problem is sometimes they forget something else. For example, a piece of sponge. You know what's gonna happen? That sponge will become a bloody and a little bit start like with a funny looking after a while. And you know what doctor will say after the next ultrasound? They will say you feel bad because you have a tumor. But that tumor actually is not a tumor, is a sponge which doctor forget at the previous surgery. That's how doctors make tumors. Forget sponge many areas. And or some type of tool. I know a lady, a young lady, she is an immigrant also. You know what happened to her? When doctors did a little surgery and when they put the stitches on the skin, they put inside a cotton, I forgot how it's called in English, a little, let's say object, a little object. A cotton piece. And you know what? A place where the surgery was done, he was bleeding all the time and stinks a lot. Stinks like a dead body. And when she went to a doctor's, they said, "Oh, it's probably a cancer. You need a chemotherapy. You don't stink. That's the cancer stinks." You don't stink. That's the cancer stinks. We have to fight with cancer. We're gonna give you a chemotherapy. But you know what the lady said? She said no. When the place where the surgery was done before was bleeding, she saw a little bit of the, how I should say it in English, nitka in Russian. A small piece is coming out, and she realized there's something else. And they realized there's a little I don't know how to call it in English, bintik in Russian, a cotton piece, material. They just left that piece in there because they were planning to give this young lady a chemotherapy. Do you know what's gonna happen after chemotherapy? A 70% die after chemotherapy, and 30 survive, and those 30 who survive, they lose everything they have because help, life extension, a lie. One day I heard on the radio a lady, I think she's a doctor, was telling another lady that they are working on helping people a lot, especially breast cancer for women, and she said that she thinks women who are younger than 40, they have to be checked for breast cancer once a year, and those women who are older than 40, they have to be checked twice per year. I just got the goosebumps on my body. I just thought, is this people know how it's gonna affect other ladies? Do you know what's gonna happen? If half of the women, half, let's say, half females will go for checkup in America for breast cancer, do you know what's gonna happen? I know not every woman will go, but let's say half of people will go for checkups for breast cancer. Do you know what's gonna be? And those half people, population in America, if they will go, probably 50% of them will be diagnosed with a breast cancer and they will need help. You know what's gonna happen then? 70% of them will die and 30 will lose their equity, their money, their husbands probably, because family may be destroyed after such a disease and such a financial collapse. All these things is a plan. It has nothing to do with health. This is a robbery, a modern way. I would say this, a cancer is a modern way of stealing and killing. I want to say a very important thing at the end of this video. When we received a letter where my mom lived under her property, that her property now, my dad's property, will have a lien because the money insurance paid and the money we paid is not enough, and now doctors need my dad's property. My sister did call those people and ask how come we're gonna have a lien under our parents' house. My dad had insurance and we paid a lot of money, insurance paid a lot of money. Why do we have to sell our house and pay you more? And do you know the answer? The answer was, well, not just your dad need help. A lot more people need the same help like your dad. Now we need his equity to help other people. See, we help your dad, and now we need his money to help other people. So that was the answer. Now, doctors, they don't care where my mom is going to live. They just think it's a good idea to sell my mom's house and take the equity, because they did help my dad to die 30 years sooner. He could have been living for 30 more years. In other words, because doctors did kill my dad, now they want his equity under his house. And I remember maybe 2 years ago or 2 or 3 years ago, I asked my dad, he was planning to refinance the house, and I kind of thought maybe it's a good idea, but maybe not. And I remember I asked him, why do you want to pay extra? And he said this, I don't need it, but you guys will need it. I want to help my youngest kid. And my youngest brother, he had a hearing problem. He cannot talk. He can talk only a little bit in English, but usually he talk in a sign language. And my dad said, I want my equity to belong to my youngest son, because his life is going to be easier. He's kind of disabled because he had a problem with speech, with talking. So maybe his life is not going to be that easy like you guys. And we were hoping, because my parents were working and paying for the house, and this house someday will belong to my youngest brother. And now looks like, because my dad was forced himself to work a lot to help his kids, especially the youngest one, looks like now the equity will go not to the youngest kid. Equity will go to a doctor who did lie to my dad. And the lady answered to my sister when my sister said, why you guys are putting a lien under the property? She said, we need those money to help other people. And she explained it in a way like, with somebody else's money we help your dad, and now we need your dad's money to help somebody else. They did not help with somebody else's money. My dad had a good insurance. Insurance paid a lot, we paid a lot. But they think it's not enough. They want his equity. Do you see a reason why doctors did burn my dad's bones, make his bones yellow? Do you see a reason why? Money. Equity. If you have an equity under your house, make sure you're gonna spend them before. If you're 50 years old, 60 years old, you're about to retire, if you're planning your American dream will make you happy by the end of your life, and you're gonna enjoy your retirement with a paid off house, maybe not. It's a good plan, but because a lot of liars live around you, make sure you're not gonna have equity. Just spend it. Stop working that much. You can start working less, because the equity you're making will go to people who don't want to work, people who want to steal and destroy. So American dream is a lie. When the people from the bank is giving you a mortgage and they're saying now the house is yours, they're actually lying. The house is not yours. The mortgage is yours, but not the house. The house, either a bank will take it from you or a doctor will take it from you, because doctor know exactly how to make you sick and for how long. Depends how much money you have. So if you have an equity, that means a doctor will have more of your money. So make sure you're gonna spend your equity. And because people die poor anyway, people don't take anything with them. Usually people give it to kids. But in our case, in our family, my dad was planning to help my younger brother because he's kind of disabled. But looks like those money will go to a doctor. That's why they send a letter and say, now we need your equity. Business. I remember on one of the appointments my dad had, a doctor said very strange thing. To me is a strange. He said to my dad, see, you have cancer is eating you. Cancer is very bad right now, and we have a good news for you. We have a new medicine, very new. It just like, a few days ago discovered. He acted like that. He said, a new medicine, never been tested on humans. Actually, once. You're gonna be a second person if you're gonna try that. The medicine was tested on rats. Do you wanna try that? We wanna help you more. You need help. You wanna try this? Just sign this paper right here. Just sign it, and we're gonna try helping you more. Do you wanna try that? And my dad said, actually my dad asked a question. He said, did you try to somebody else this new medicine? He said, probably you're gonna be a second person. And my dad said, what this medicine will do to me? And doctor said, I don't know, it should stop cancer. How you like this type of answer? What are you gonna do if you're gonna be in a situation like this? Doctor is offering you a medicine, and he don't know what this medicine will do to you. And when my dad start refusing it, I saw a doctor, he put his hand in a packet and he looked at like this, and I thought he's watching what time is it, and put that little device back to the pocket. After my dad finished talking, and doctor did the same thing, and then I realized he pressed the button. He recorded how my dad is refusing his help. So now doctors have a recording of my dad's voice, how my dad refusing their help. But we don't have any recording how they were saying before, go home and die, things like that. You don't want to listen to us, just go home. We don't have a recording of that. And somehow it's illegal to record a doctor, but it's totally legal for doctor to record you. It's totally legal. And I remember a last appointment when my dad was in a wheelchair, when my brother was with him. And my brother told me when the nurses saw my dad coming in a wheelchair, nurses said, You don't need to come here anymore. Um, you don't have insurance anymore. Just stay home, okay? Just stay home. Yeah. How are you gonna like that? When a doctor telling you we're helping you, but in reality they are stealing your health, and when they do steal your health, then they say, go home, just stay home. You don't have insurance anymore. How are you gonna like that? How you can fight with this? How I can fight with this? I don't think I can do anything, but a lot of people, I believe people can stop this, but not individuals. No. Probably, I don't know. Probably a lot of people will need to die before something is gonna change.